Good afternoon, everyone. Hope everyone is doing well on this fine May 11th. Thank you for joining us. If you are here at the community, joining us live, or if you are viewing this tonight, thank you for taking precious time out of your day to listen to some information about our state of affairs here at Cedarfield. Happy belated Mother's Day to everyone. I hope everybody found your day being celebrated in different ways yesterday. Hopefully you connected with people near and far. Hopefully folks near and far also connected with you in different ways yesterday to celebrate Mother's Day. So I first thought we'd start off with what I'm going to coin, just taking a page out of the Commonwealth of Virginia, the governor, Cedarfield Forward. He labels it Virginia Forward. And just talk a little bit about our path forward here. That would be the first thing. We're going to talk a little bit about the governor's press briefing that he just concluded. And in that briefing, I'm going to talk a little bit about actually what he had said on Thursday and Friday of last week, and have some administrative updates, and then I believe Trish Carter is going to close us out with some spiritual well-being. So first, Cedarfield Forward, just want to emphasize that our three-phase blueprint that we're about to create is a pre-vaccine three-phase plan. Our goal has been and always will be the safety and the well-being of our residents and our team members and families. To that end, the governor's multi-phase plan to reopen Virginia, which looks like will commence this Friday. The plans we are developing will also be multi-phased and cater to each department and cater to each of our 5 neighborhoods. Unlike the governor's plan, we will only implement our plans and move through each phase of those plans if we are successful in keeping the COVID-19 virus out of Cedarfield. I am sure you are all looking forward to a new normal life at Cedarfield, much like the plan for the Commonwealth. Cedarfield will not be flipping on a switch. We're going to, as the governor had said last week, we're going to use the dimmer switch, a little dial switch, to bring services back to a new normal. In fact, we must be prepared to have some significant changes in services and programs and policies until that vaccine is readily available. And even after that, I would imagine that hundreds of folks gathering in this fellowship hall may be a little way off, even after that vaccine is created. So our plan, our Cedarfield Forward plan, been thinking about this all weekend, really must have a balance. It must have a balance between, I took 10 different items here, top 10 consideration items that we really need to keep in mind as we are developing our three-phased free vaccine plan. We need to take into consideration these 10 items. First and foremost is that the virus is still with us. And until that vaccine is created and widely available, we need to be vigilant in our understanding and our thought process that this virus is not, it's still here. And a lot of the research, as you probably have seen across networks over the weekend, that there will be a second wave coming towards the latter half of the year. And that second wave is going to coincide with the influenza season. And so this is the really first critical item I think we need to take into consideration when we're balancing our plan. The second is that the shutdown of the economy and the reopening of businesses, places of worship, etc., all of those items are going to be going through a three-phase plan that comports with what the governor thinks is realistic for all of different counties and cities in the Commonwealth. So we need to take that plan and we need to tailor it specific to Cedarfield. Number 3, isolation from people and loved ones. So the governor talked about on Friday how in each of his phases that visitors to senior living communities needs to be taken under heightened surveillance and making sure that those the visitors and the timing of when you allow visitors back onto the campus really needs to be closely monitored. And so number 3 of this plan to balance is making sure that we introduce visitors coming back to the community at an appropriate time. We need to consider social isolation right here at Cedarfield, both residents and team members alike. I heard a quote, if I heard it once, I probably heard it several times, that social isolation could account to almost 15 cigarettes a day if somebody was smoking. So that's how potentially dangerous social isolation is. So we need to take that into consideration. Number 5, we need to take into consideration that due to some of the restrictions or some of the, due to that social isolation, that there are health consequences occurring right now and into the future if we don't look at creative ways so people can exercise, get the right nutrition, etc. We need to really look at this on a case-by-case basis. Number 6, one size does not fit all. And so here locally at Cedarfield, what a plan may look like for the dining services department and a phase plan may not look like what that phase plan looks like for housekeeping. Or what maybe we do for the lane, cottages on the lane may not comport with what we do with cottages on the court. We need to, as we develop our plan, we need to take into consideration that perhaps maybe the entire plan isn't the right plan for the entire campus. Number 7, the science and the healthcare folks, Dr. Fauci, Dr. Burke, Dr. Oliver here at the local level, our governor, and the folks that live here, the folks that work here, we all have differing views and differing perspectives on things. And we need to tap into that creativity in order to come up with a good current plan, and then make sure that that plan is fluid and flexible in order to meet changing needs that will happen going into the winter season. Number 8, speaking of that dialogue, the discussion should be respectful, it should be collaborative, we should take all viewpoints in consideration in developing this plan. When I think about this one particular bullet point, I really think of Maudie Lynn and Barbara Fiske last week talking about our diversity and inclusion action team and all the work that they have accomplished over the last 18 months here at Cedarfield, and utilizing a lot of that learning to really come up with a good plan. Number 9, new norms must be created and implemented and adhered to by everyone. Again, going back to inclusion and helping everybody be on the same page. I think as we create our new norm, which will last probably for 18 months until that vaccine is created, we need to be kind and we need to be sensitive to the fact that everyone's going to have different viewpoints on what we actually create, and that's okay. We're going to try to take as best we can consideration from all viewpoints, but at the end of the day, when we come up with a plan, I'm hoping that this new norm, that we all take it and own it, have our own self-accountability towards it, so that we can implement a new plan together as a community. And then number 10 on my list is making sure that we are going back to number 1, because the virus is still among us. It's in our community, it's in the nation, it's not going to go away until that vaccine is created. That number 10 for me is just keeping foremost on our mind that we have a job to protect the most vulnerable population. And I don't mean to label anyone, but the fact that this virus, and I'll show you some statistics here moving forward, this virus really thrives on people that are 65 years of age and better. And so we just need to keep that totally focused on the forefront of our mind as we're creating a new blueprint for Cedarfield and the safety and well-being of our residents and our team members, and certainly the families that will be coming, will be coming to visit as we unfold that phase. So the departments and I had mentioned this, I think once or twice last week, the departments, the dining department, housekeeping, maintenance departments, philanthropy, administration departments, wellness and leisure, pastoral services, transportation, the concierge desk, event setups, we're all developed in conjunction to the 5 neighborhoods. When I say neighborhoods, I mean Sunshine Plaza, our memory support area, assisted living, and then there's 3 neighborhoods up in Health Center, which are labeled right now North, Central, and South. So our departments in our neighborhoods have been meeting over the last few days. Today is our deadline, come sundown today, to have a first draft of what everyone's thinking. And so just want to let everyone know we're not just talking about developing our 3-phased pre-vaccine plan. It's absolutely in motion. I want to thank Carol Marco. She has collected a lot of information and emails and phone calls from residents. She did forward to me a Word document collecting all of that information together, so thank her. There have been several residents over the weekend that have provided some insight into what this 3-phase plan should look like. And I just want to thank you for taking time out on your weekend to really take serious consideration to what you wrote up. There are many examples of residents who provided us with some very thoughtful ways to unfold services and amenities that comport with the governor's guidelines here and even the federal guidelines. So thank you for taking, like I said, thank you for taking time out to do that. Last week, Eddie, can you zoom in on this for me? Last week, I believe on Friday, I talked a little bit about how we were developing our plan, and while And I think I said the phrase, "It scares me to death." I think that's the phrase I used. And here's the reason why, not that I'm scared of developing a plan or implementing a new plan or creating different levels of service and amenities to meet what our new norm is. We have to go through that. As one quote, a resident provided me a quote over the weekend about life, and we need to adapt a new way in order to survive and to live. That's absolutely imperative. What does give me pause is the aggressive nature of this virus, and some of these statistics here are provided by one of our residents, and you can see at the top, it talks about the flu. During the 18-19 influenza season, we had 33 million cases, of which 810 were hospitalized. Unfortunately, because of that outbreak, as we do in any influenza season, we had 61,000 deaths. So that equates to a 0.1% of people who passed away that were actually confirmed with an influenza case. If you compare that with COVID-19, and more specifically, even the data here in Virginia, you can see the governor just talked about having 25,000 cases in the Commonwealth. We roughly have about 3,000 hospitalizations, and as of the governor's briefing a couple of moments ago, he talked about the unfortunate people who passed away, which equals 850. So if you do that math, that's 3.5% of people who unfortunately pass away who have been confirmed with a positive case. Or that's almost 20, that's a 20 times a rate of the flu. Okay, you can come back. And so that's what gives me, that's what in general gives me most pause, is that while there's many diseases that we all fall to, including influenza or pneumonia, the fact that we don't have a vaccine yet for this one, and we won't for a while, and because we're going to unfold services and amenities, and team members or families and residents will be out in the community doing their maybe normal thing. Hopefully we all learn on our new norm outside of Cedarfield, so that as we're coming back to Cedarfield, we're protecting this community as best we can. That's what really gives me the most pause, that we're all taking seriously and applying our own new norm in order to A, protect ourselves, and then B, protect the people that we live around and that are neighbors of ours here at Cedarfield, knowing that there is no virus yet, and it may be, there may be restrictions at different businesses out and about in the marketplace, but do those businesses really take those restrictions seriously, and are our team members or residents taking those restrictions seriously when they leave the campus? So again, we've said this many times, we're all in this together, and to the extent that we apply our accountability to all of those other restrictions in and around Cedarfield in the marketplace and also here, will determine how successful we are going forward in this three-phase, pre-vaccine world that we're going to live in. Okay, next up, Virginia Governor Northam just got done a briefing. and he talked a little bit about the data, the overall more testing that happened over the weekend. He showed some slides that I don't have here available, but he talked about some slides, the total cases confirmed, talked about the percent of positivity within those cases. He was pleased to share news that there's still a downward trend in positive tests, except for Northern Virginia. He talked a lot about the Northern Virginia site area. He talked about the downward trend in hospitals and nursing homes and retirement communities needing PPE. In fact, there's several days now where no one has requested PPE from the Commonwealth. He talked a little bit about hospital having capacity still, and that's true of this area. St. Mary's, in Rancho Doctors Forest, and Parham, to name three, definitely have capacity, and that ventilator capacity within the hospitals within the Commonwealth remains at about 20%. So all of that news is good news in terms of things trending downward in order for the governor to enact phase 1 coming this week. He did mention, which I thought was an interesting tidbit, about retail testing. He seemed pretty excited to announce something. He announced it today, but like a more formal announcement over this next week, where different retail establishments will be able to do testing as well here in the future. He talked about St. Petersburg. Apparently there's 46 homes down there that got their water turned off. So he talked about issuing a public health certificate, allowing those 46 homes to receive water again. He talked about the DMV, which is still closed until next week. And then he talked about the absentee ballot. If you wish to vote via an absentee ballot, they are due, and you know what they're due? They are due tomorrow. So you can go on to the website and make that known if you wish to do that by absentee ballot. Otherwise, there will be some very safe ways that they will be creating in order to vote at one of the high schools. Dr. Oliver came up to the podium and talked a little bit about the fact that Virginia has 25,070 cases now. That's an increase of 989. He talked about the unfortunate deaths of 850, which is an 11 increase from this time yesterday. And then in total, talked about 167,758 tests that have been completed. And again, almost 9,000 of them were completed yesterday. On Friday, he did talk about what he wanted to see in order to enact phase 1, a downward trend, a percent of positive tests over 14 days. He wanted to also see a downward trend of hospitalizations over 14 days, increased testing and tracing, which 9,000 tests from yesterday, I think is very indicative of the amount of tests that's happening. Enough hospital bed capacity and intensive care capacity. One item on here that is left off is he's looking at ventilator capacity, and then the sustainability of supply of PPE in and around the Commonwealth. So this is what he said Virginia is looking at in order to move to phase 1, what phase 1 looks like for him, and also this is language that was used by Chris Henderson, our Chief Executive Officer, in his memo that he wrote to everyone late last week. We are safer at home, especially if you are the most vulnerable among us. Talked about no social gatherings of more than 10 individuals. Talked about continued social distancing, teleworking, face coverings recommended in public. I'm still amazed by this one. As I went to the supermarket on Saturday, I was up in people who I was passing in and around the supermarket and CVS. I was at CVS picking up some meds for my son. And at a Kroger close to my house, almost 70% of the individuals in that supermarket were not wearing a face covering. And at CVS, it was a little bit different at CVS. 50% of the people that I counted, that I came in contact with as I was going down the aisles, which was only 4 at CVS, but 2 of those 4 were not wearing face coverings. So, this is why this all gives me pause about developing a phase plan, because we're all in this together, and to the extent we're all taking these things seriously and implementing to develop our own accountability, will determine how successful we are moving forward as a society. Easing limits on businesses and faith communities was his last item that he had referenced on Friday. I thought this was an interesting slide that he used last week, talking about moving Virginia forward in phase 1. You can see in the left-hand, the center column is what we have now, and over on the right-hand column, it talks about what phase 1 will look like. And he breaks down a number of categories. At the top, talks about non-essential retail. Talks a little bit about restaurants here in that second row, that we have takeout and delivery now. And moving forward, we will continue to have takeout and delivery, and maybe outdoor seating at 50% capacity. He talked about entertainment and amusement category, that both now and through phase 1, those items will be closed. This next one hits home to Cedarfield, fitness and exercise. Gyms, etc. are closed now and through phase 1. They'll continue to be closed, but we should have an emphasis on limited outdoor fitness, which we intend to do. Thank you, Elizabeth Caldell, for developing a program this week. The beaches, now exercise and fishing only are open. Talked about places of worship, drive-in services, now in 10-person limits. Moving into phase 1, not quite sure if this would even apply to Cedarfield. Drive-in services at a 50% indoor capacity. I know many people enjoy our pastoral services team, so to think that we could probably do an event at 50% capacity is probably not in phase 1 here at Cedarfield. Personal grooming, he talked about those items being closed now and by appointment only. Private campgrounds, state parks, child care, open for working families. This one really hits home for our team members, obviously. And then he talked about gatherings, 10-person limits now, and then that will continue to be a restriction moving into phase 1, a 10-person limit. And then there you can see at the bottom face coverings, where he's strongly recommending that we wear face coverings now and even into phase 1. So if anybody would like, it took me a little while to find this on the website. If anybody would like a copy of this, just please send me a text or an email, or call down to the administration suite. I'll be happy to get you these slides. This slide right here happens to be a summary of the previous 3 slides. So I thought it was an interesting way of just simplifying the data and simplifying different categories of either now or what he views as going into phase one. Now next is our little segment of our COVID-19 communication. We've been talking about preparedness plans. So on this live chat, moving forward, you're going to hear COVID-19 communication as one little segment, and then at the top of this live chat, we're going to talk about the reopening plan and that evolving plan, so you can see how both of those plans parallel to each other. But this, I have a little condensed version of this COVID-19 plan. I just have 2 slides, so bear with me. This first one goes into what our preparedness plans are. Right now, we are in a 4-fold mode. One is aggressive infection control. Secondly, as I reported last week, we have developed a COVID-19 neighborhood on the south side of our health center. So if you were walking down the hallway, headed to where the great room is at, and if you were to make a left-hand turn, there are about 10 apartments down in that side of the health center that's now considered a COVID-19 neighborhood. And the staff did an amazing job over the weekend of taking care of residents inside of that neighborhood. It was really, Jack and the maintenance team rolled up their sleeves. The nurses, the dietary staff did really an amazing job all weekend long, making sure that people got what they needed and delivered great care. So that's in place, and then we're continuing to monitor our own PPE levels. We have a good, healthy number of personal protective equipment, and then Connie McGowan is certainly going through and training with team members in really all 5 of the neighborhoods to make sure that we are practicing what our policies say and our assessment tools. And then the last slide for COVID-19 communication. Can you zoom in on this? Everyone has trouble reading this. This is only changed by 1. This is a disclosure of information. This is a cumulative number to date. We've had 45 residents tested for COVID-19, 8 of which have tested positive. We've had 82 team members that have been tested, and 8 team members have tested positive. Believe it or not, it's been 2 weeks since a few of these team members have were tested positive, and a couple of them are back now at work, today being their first day. So we welcome them back. It was a little rough road for 2 weeks as they went through the process of their own way of dealing with this COVID-19. So we welcome them back. So those are some cumulative statistics. Hopefully everyone has had a chance to read Chris Henderson, our Chief Executive Officer at Pinnacle Living, Cedarfield of which is a managed community of Pinnacle Living, owned and managed. So if you have any questions about that memo that we distributed on Friday, please feel free to call down to the administration suite at 804-474-8850, and we'll get to your questions just as soon as we can. For the families that are near and far, this little segment is for you. Many families are talking about how do we video conference our loved one in assisted living, Sunshine Plaza, with a health center. We were in the administration suite probably because of the heightened awareness of Mother's Day weekend, we received 29, 30 different telephone calls or emails about who to call in order to access video conferencing for their loved one. And so if you are watching tonight, if you are the son or the daughter or a loved one, a friend, and if you wish to video conference somebody that is in our health center, feel free to contact Katie at that number if your loved one lives on the north end of the health center. If they live in the central, contact Barbara Helm at that number, 8865. And then on the south neighborhood, you can contact Zach Barrett at 8857. Those of you that have a loved one in assisted living, you can contact Morgan. She is the neighborhood leader in assisted living at 8731. And then Shannon Gus down in Sunshine Plaza at 8882. They would be glad to schedule a time for you to be able to video conference with your loved one and or a friend. The Supply Shuttle Program kicked back up today for residents that live in the independent living apartments. So families that are listening, if you have somebody that lives in the cottages in which you wish to send them some goodies or likes of the resident, on Wednesday, we're going to kick back up with the cottages from 1 o'clock to 3 o'clock, and you can drop off that bag of goodies for them over at the corner of Maynard and Gaston. I do not have any new information about our construction updates. I do believe this Parkview entrance project should come to a close this week. I haven't heard any differing news. I'll try to get some news here tonight from the general contractor to make sure that we're going to conclude that project here by Friday. Grocery shopping. Those of you that wish for our Cedarfield team to do some shopping for you, tomorrow we will be shopping for residents that live on the second floor of this main building here. And so orders must be turned into the phone line by tonight, not Sunday, by tonight at 8 o'clock, the 11th. And the number is 474-8895. Pause here for a couple minutes. Anybody have any questions? One question came in on the cumulative total listing. You had said that 8 residents have tested positive. Is that currently 8 active cases or 8 including any deaths that may have occurred? That 8 cumulative number is 8 residents that have tested positive for COVID-19 cumulatively throughout the months of March, April, and May. Another question came in. How are approved medications, those testing in healthcare, how are those, not quite sure what that question means. Any question I don't understand, I will call you for clarification. Another comment came in that said, Publix customers more likely to wear face masks than Kroger's. That's interesting. fewer customers in Publix stores. Publix has done a great job with single directional signs, cleaning carts, and keeping customers 6 feet apart. Okay, those of you that did text and I didn't get to your question, I apologize. I need a little further clarification. I will call you tonight. Okay. Anything else we need to cover? No. Next up is Trish Carter.
Good afternoon, Cedarfield. Today I'm going to share a prayer that most of you have heard before. It's sometimes referred to as the peace prayer, and it has been attributed to St. Francis, although not necessarily written by him, but a lovely prayer. Lord, make me an instrument of your peace. Where there is hatred, let me sow love. Where there is injury, pardon. Where there is doubt, faith. Where there is despair, hope. Where there is darkness, light. And where there is sadness, joy. O divine Master, grant that I may not so much seek to be consoled as to console, to be understood as to understand, to be loved as to love. For it is in giving that we receive, it is in pardoning that we are pardoned, and it is in dying that we are born to eternal life. Now for our good news. It's coming. Yay! Our good news today is that Ellen Woodall's grandson has sent us, first of all, this photo of finding these beautiful 5 little tiny bird eggs. And next we will see what his family observed. Look at that. Look at that. I hope you can see those tiny little beaks. And we have one more video. They all hatch. What a miracle it is if you've ever had the opportunity to see a nest of little eggs and watch as one by one they hatch, and you get to hear that sweet little chirping noise. I will share that one resident a couple years ago, when she needed to move from independent living to healthcare, as she was making her way, she said to me, "There's a bird's nest on my back porch. Don't let anyone mess with it." So the miracle of new life in these little birds gives us so much hope for the future. Please send in your good news. Thank you.